In 2012, 14.1 million people were diagnosed with cancer globally. The World Cancer Report, produced by the WHO's Specialized Cancer Agency and released on World Cancer Day, predicts new cancer cases will rise from an estimated 14 million annually in 2012 to 22 million within 2 decades. Over the same period, cancer deaths are predicted to rise from 8.2 million a year to 13 million. CNN. In Indonesia, the prevalence of cancer is 1.4% of the population, or an estimated 347,792 people, according to Indonesia Health Ministry. Cancer, also called as malignant tumor, is caused by abnormal growth of cells in the body. Not all tumors are cancerous. Benign tumors don't spread to other parts of the body. In Indonesia, cervical and breast cancer rank as the highest incidence of cancer. In 2013, it is estimated that 98,692 Indonesian women were diagnosed with cervical cancer and 61,682 Indonesian women suffering from breast cancer. The current medical practice provides 3 main treatments for cancer: chemotherapy, radiotherapy, and surgery. Chemotherapy uses cytotoxic anti-neoplastic drugs to directly attack cancer cells. Side effects of chemotherapy include immune suppression, myelosuppression, gastrointestinal complication, vomiting, and anemia. Radiotherapy works by damaging DNA of cancer tissue, thus leading to cellular death. The side effect of radiation is more limited since radiation beam is projected to a specific tumor area in the body. Understanding that medical treatments aggressively attack both cancer and healthy cells of the body without supportive medicine, cancer patients often experience low quality of life. For example, chemotherapy suppresses the patient's immune system, may disrupt digestion system, and reduce the production of red blood cells. Consequently, the patient might experience fatigue, indigestion, and lightheadedness. The good news is, TXL Phytoceutical can counter and reduce most of these medical treatment side effects. Therefore, cancer patients can experience a much better quality of life compared to those who only receive medical treatments. There are 3 main functions of TXL. 1. Immunomodulation. TXL is able to regulate patient's immune system to its optimal level that this immune system is able to defend against cancer cells naturally. TXL, former name THL-P, is the only herbal medication recognized by the American National Cancer Institute, NCI, with potential antioxidant, immunomodulating, and anti-neoplastic activities. In NCI Thesaurus, it is defined that TXL may modulate the activity of natural killer NK cells, cytotoxic T lymphocytes, CTLs, macrophages, and polymorphonuclear leukocytes. 2. Reduce the side effects of chemotherapy and radiotherapy. TXL reduce the side effects such as pain, fatigue, vomiting, hair loss, and the low blood cell counts. This allows cancer patients to experience higher quality of life. A clinical trial of the safety and efficacy of TXL for patients with refractory metastatic breast cancer was conducted in National Taiwan University Hospital in 2012. The result shows that the TXL group had significant improvement in global health status, quality of life scale, CD3, CD4, CD8, and CD19. The TXL group of patients had higher levels of physical, role, emotional functioning with decreased fatigue and systemic side effects. 3. TXL increased the efficacy of conventional medical treatments by lowering cancer cells' drug resistance and allowing cancer cells to be more sensitive to radiation and chemotherapy. A research in Taipei Medical University, 2012, shows that TXL works synergistically with doxorubicin to inhibit HUH7 hepatoma cells. The research also shows that TXL is able to suppress cancer stem cell and therefore reduce the possibility of cancer recurrence. Other pharmacological functions of TXL according to published research: apoptosis of cancer cells, inhibition of metastasis and angiogenesis. Today, after 25 years of being used in more than 10 countries in the world, the use of TXL for cancer patients has been studied in more than 20 research cases, 13 of them being published in peer-reviewed international medical journals. In 1999, TXL received an approval certification from FDA America. So far, there have been 2 clinical trials done on TXL. One is in Taiwan National Hospital, and the other one is in Dharmai Hospital, Jakarta, 2011, on nasopharyngeal cancer patients. Below are comments from leading oncologists who prescribe TXL. 1. Dr. Obitsu Ryochi, PhD, founder of Obistu Sankei Hospital, Japan. I mainly use TXL to treat with cancer recurrence. 2. Professor Stephen Wing, University of Hong Kong, School of Medicine. TXL suppress all 3 cancer cells, breast, liver, and colon cancer cells. 3. Dr. Chi-Ming Lai, National Health Research Institute, Taiwan. Cancer stem cells resist chemotherapy and radiotherapy. TXL may act as therapy to target cancer stem cells. For more information, contact us at toobatkanker.com and dms-group.co.id.